Good morning, William. I'm gonna wash my hands, check your name and date of birth on your wristband. Good. I'm gonna check your vitals. I listen to the apical pulse for the full minute, and the normal range is 100 to 160. I listen to the respirations. The normal respiratory rate is 30 to 60. I'm going to listen to his bowel sounds. Those are all active. Listen for a full minute. I'm going to check his temperature under his arm. The normal is 97.5 to 99.5. We're going to start at his head. No overly flat spot on the back of the head. The fontanelles are soft but not too sunken in. Sutures are close but not too close, and they are soft. No bruising, scarring, molding, so there's no like cone-shaped captum succedaneum, which is the swelling, and there's no acephalohematoma, which is the bruising, so that's all good. So everything looks symmetric. Okay, now I'm going to check the ear for recoil. It's instant, so that's good. The ears are in line with the eyes, so that means that he doesn't have Down syndrome or is a sign of Down syndrome. Checking the eyes, they're 1/3 of the face. The epicanthal fold doesn't exist, which is another sign of Down syndrome. There's no drainage, no crusties, no redness or swelling or anything like that. I'm going to check the nasal patency. So I feel the patient breathing. Other side, feel him breathing. Good. I'm going to check the mouth. To feel it, to make sure that the hard and soft palate are intact. Good. The hard is in the front, it's intact, and the soft is in back, and it's intact. Alright, I'm going to feel the baby's neck. No masses. You can turn. Good range of motion. Wonderful. We're going to look at the chest. The skin is pink. Also, above the chest, before I should check the chest, but the skin is pink. I have to make sure the clavicle, to make sure that it didn't break whenever he was coming out the birthing canal. When I was checking the inside of his mouth, I was also felt the suck reflex, so that's good. But the skin is pink. There's no scrapes or scars or rashes. Everything looks really good. There is a good blood flow, so I can tell of that. There is no jaundice, which you would look at the head, the forehead, the chest, the abdomen, which is none, the thighs, and the eyes. The eyes are good too, so that's all good. We also checked the abdomen for, which I already checked the bowel sounds, but it is soft, not distended or anything of that nature. Then I move on down. I'm going to put back on gloves to check out the diaper and the peri area. While I'm here, I'm going to check the umbilical cord. It is a little moist, and the clamp is intact. So hopefully within a few weeks it dries out more and falls off. But since he's new, just born into the world, it's still a little moist. William is a boy, and so his testes are descended. He has rugae. The meatus or his urethra is at the tip of the penis. Everything looks normal, no overly swollen or anything. For a female, you're going to check to make sure that the labia is covering the minor labia and the clitoris. He did not void or have a bowel movement, so that's good. If he did, I would chart it. And for the boy also, You want to check to make sure that the penis is circumcised per the family's request. Okay. Moving on. I'm going to check the skin turgor in the inner thigh. Comes back great. If it took a little bit, that could be a sign of dehydration. I'm going to check a reflex. Lift the arms up, lift them down, and the arms fly back up, so that's good. Reflexes are intact. I'm going to look at the palms. There is a crease, that's good. He does grab my finger, which is also good. If they only had one crease, it could be also a sign of Down syndrome. I'm going to look at the bottom of the feet, which are good. Good amount of creases, which is great. Also, I've noticed with my patients' respirations, if they're struggling to breathe or anything of that nature, you would have apnea, which is no breathing longer than 20 seconds, nasal flaring where they'd be popping out, seesawing, retraction of the ribs, and grunting. So that's all good because William doesn't have any of that, which is wonderful. I'm going to try to keep him warm while I turn him over. But we got to look at the back. I know he's a little fussy, but overall he's doing pretty well. I mean, I understand why he's fussy with the cold. Okay. I'm going to turn him on his back. The spine is midline, which is great. At the bottom of his back, there is no tuft of hair or dimples, which is a sign of spina bifida. I'm going to take off his diaper again to check out his buttocks. Okay, so you see the smile, the leg creases line up symmetrically. He also did not have a bowel movement, so I wouldn't worry about charting any of that, but I would chart it if he did have a bowel movement. His legs are symmetrical, so that's good. So there's no tuft of hair. Oh, let me get you dressed. I don't want you to get all chilly. We gotta keep the heat in because babies lose heat very, very quickly. Sorry. Got you all wrestled up for mom, didn't I? So now I would ask the mother, which is Sheila, some questions. Sheila, I'm just curious, when's the last time you fed William?
In the last hour.
Good. Are you breastfeeding or bottle feeding?
Breastfeeding.
Okay. And how is he doing with that?
Very well.
Good. When's the last time you changed his diaper?
I'm pretty sure maybe 20 minutes ago.
And how is that going? Does he seem to get fussy when he urinates or has a bowel movement or poops?
No.
Okay. Also, before I leave, I'm going to check the bottom of William's foot because I forgot about the Baginski. You do a J, so you start at the bottom and you go up to the heel, and the toes flare, so that's good. In adults, the toes don't flare because that would be a sign of a disorder. I'm going to swaddle you back up. Okay, also, we're going to check one more reflex, which is called the Moro reflex, where I'm going to slap the table, and his hand should fly up and make a C, so we'll see if William does that. Oh, yes, most definitely. His hands flew up, made the C, which is good. Mom, do you have any questions for anything about taking care of William or any other questions that you may have?
No, I don't think so.
Okay. Well, little William, you look good. You're all cuddled up. We might be coming in shortly to give him a bath.
Okay.
Okay. So now I'm out of the room. Like I said, he was a male, but if it was a female, I would have been checking for different genitalia things, which would have been the major lamina longer than the minor and covering the clitoris. Also, he was a little fussy, but I think that was kind of expected with me kind of moving him around. But overall, he seems to be doing very well. Everything's looking very positive.